We don't need to say, I heart diversity. We need to move beyond.
Not only do we need to be diverse, but we need to be inclusive, and there's a lot of work that still needs to get done.
Diversity and equality is certainly something that we prioritize for our faculty and trainees.
For American Thoracic Society members around the world, improving diversity and representation is a common goal.
I think diversity in our section is really critical.
I think that's critical in really providing the best quality care to patients, and that's part of our mission here at Yale.
We are basically recruiting people who will help us serve the community better.
And we're working hard to make our place a welcoming home where people from all walks of life would naturally come to Stanford for their care, and to have our faculty reflect our patient community as well. It's a critical piece.
Improving diversity and representation is an ATS core value.
As the American Thoracic Society, we have an opportunity to really influence the future workforce and bring more diversity into pulmonary and critical care medicine.
And then our patients are going to benefit because they're going to be taken care of by providers who also have adequate representation, who also understand these concepts, and then we can create a more diverse pipeline.
We have to make the structural adjustments so that we fuel and we populate our own pipelines.
It's a key focus for pulmonary divisions and universities across the country.
And we've done it systematically by changing our recruiting practices and changing our interview practices. We have been able to recruit several more fellows from underrepresented backgrounds.
And so one of my passions earlier in my career was to try to get the faculty to look more like the population of LA and the population that we serve. And by being successful in the training program and retaining a lot of those trainees onto our own program, that's how we've created the diversity of our faculty. And we're not there yet. We have a long way to go.
We had a lot of internal discussions about what diversity means, that it's not only, say, skin color, right? There's a diversity of background, there's a diversity of what people have as their career interest.
Increasingly diverse and engaged faculties are determined to build a culture of safety, inclusion, and gender equity.
We think a lot about recruitment and retention of underrepresented minorities and women in medicine.
It's a very warm group. It's a very diverse group. More than 50% are women.
And continues to be a reason why I stay here is the number of strong women in all aspects of medicine, whether it's in clinical care, in investigation and research, or in healthcare administration.
Gender, cultural, and social diversity help address challenges within the profession and the patient population.
Those differences help us identify some of the blind spots that are created when everyone has the same ideas.
It is the diversity of the faculty and trainees that we have. It's the diversity of care that we give to patients. And we do that not just on the clinical care side, but also on the investigative side. So right from bench to bedside, from scientific discovery to the care of patients.
Patients need to be knowledgeable. They need to have be given the information. They need to have opportunities for care.
The ATS, as a society, has taken major steps to play a role in helping eliminate disparities through increased health equity, diversity, and inclusion.
This is an institution that's prepared to put money where its mouth is. They've devoted resources to actually making EDI a priority, and not just a priority, but a reality. I don't take for granted, and I don't take it lightly, that not only am I at the table, but I have a voice at the table to impact things as well. Like my lived experiences bring something in there.
And a diverse collection of voices fosters innovation.
If we are really able to value differences, we can also improve our capacity of being innovative. We want to be innovative and we want to be creative.
I actually feel that I can make a bigger difference by helping others succeed, by allowing them to create their vision.
I've just been so impressed with the willingness to say, what do you want to be? What do you want to do? But instead, if what you really want to do is education, or you really want to work on diversity in medicine, then let us help you achieve your goals and stay in academic medicine. We find that that's more likely to help people succeed.
The pathway towards medicine is not so clear for someone who has not seen a lot of doctors in their own communities. I think one of the biggest appeals of UCLA as a pulmonary division is its ability and its willingness to ask the trainee, ask the investigator, what is it that you're trying to do? What are the questions that you want to answer? And how can we help you do that?
What that looks like is going to take a lot of creativity. It'll take a lot of piloting. It'll take people in a room saying, what do we need to do from point A to B to C to D that has not been done before? And I think ATS will be involved in those conversations.